Sickle cell disease is a type of hemoglobin disorder, inherited blood diseases that affect how oxygen is carried in the body. SCD is characterized by a modification in the shape of the red blood cell from a smooth, donut shape into a crescent or half-moon shape. Misshaped cells lack plasticity and can block small blood vessels, impairing blood flow. This condition leads to shortened red blood cell survival and subsequent anemia, often called sickle cell anemia. Common symptoms are jaundice, liver and spleen enlargement. Stem cell or bone marrow transplants are the only cure for this disease, but they involve significant risks. India is the second worst affected country in terms of predicted births with SCA. Sickle cell disease is more common in tribal populations in India due to malnutrition. There are several types of sickle cell disease, with the most common being sickle cell anemia. Other variations include sickle cell hemoglobin C disease, sickle beta thalassemia, and others. Sickle cell disease is caused by a mutation in the gene that codes for hemoglobin. The mutation leads to the production of abnormal hemoglobin known as hemoglobin S. If a person inherits one normal hemoglobin gene and one sickle hemoglobin gene, they have the sickle cell trait. Individuals with the trait usually do not experience symptoms but can pass on the defective gene to their children. Sickle cell disease can lead to various complications, such as acute chest syndrome, stroke, organ damage, and even vision problems. These complications can be severe and require immediate medical attention. Hydroxyurea, one of the main treatments for sickle cell disease, is hydroxyurea, a medication that can increase the production of fetal hemoglobin. Fetal hemoglobin is less likely to form sickle-shaped cells, thus reducing the severity of symptoms. Blood transfusions. Regular blood transfusions can help manage anemia and prevent certain complications. However, long-term transfusions may lead to iron overload, which requires additional treatment. Bone marrow transplant. A potentially curative treatment for sickle cell disease is a bone marrow transplant or stem cell transplant. This procedure replaces the faulty bone marrow with healthy stem cells from a compatible donor. Management and support. People with sickle cell disease benefit from a comprehensive approach to manage their condition, including pain management, vaccinations, antibiotics, and ongoing medical care to prevent complications. Advances in research. Ongoing research aims to develop new therapies, gene editing techniques, and improved treatments to enhance the quality of life and outcomes for individuals living with sickle cell disease. It's important to note that every person's experience with sickle cell disease can vary, and a multidisciplinary team of healthcare professionals plays a crucial role in providing comprehensive care to those affected by this condition. Early diagnosis, proper management, and support can significantly improve the quality of life for individuals living with sickle cell disease. Measure taken by India. The Prime Minister of India has launched the National Sickle Cell Anemia Elimination Mission. Initiatives taken to control sickle cell anemia. National Health Mission (NHM) guideline on hemoglobinopathies encompass all genetic diseases of hemoglobin, identifies establishing services at the community level. It will be for premarital and preconception screening backed by genetic counseling services as a strategy for addressing SCA. Government plans to distribute special cards across tribal areas to people below the age of 40. Cards will be divided into different categories based on screening results. The mission will receive funding under NHM. Ministry of Tribal Affairs launched a portal wherein people can register themselves if they have a disease or trait to collate all information related to SCA among tribal groups. It's important to note that every person's experience with sickle cell disease can vary, and a multidisciplinary team of healthcare professionals plays a crucial role in providing comprehensive care to those affected by this condition. Early diagnosis, proper management, and support can significantly improve the quality of life for individuals living with sickle cell disease.